Okay, this is lecture 5, the long-awaited lecture 5. We are going to talk about farnesyl transferase inhibitors. Well, basically, we are going to start talking about the signal transduction pathway inhibitors. And first, we will talk about the RAS protein. And since we are talking about the RAS protein, we are going to talk about the farnesyl transferase inhibitors. So since we mentioned RAS protein, so what is RAS protein? It's a signaling protein that is crucial to cell growth and division. Okay. The RAS protein, the abnormal form, is present in 30% of cancers, prevalent in colonic and pancreatic cancers, as example. Okay. They found the abnormal RAS form is prevalent in colonic and pancreatic cancer. The abnormal RAS is coded by a mutated RAS gene, or as you can call it, RAS oncogene in this case. RAS is a small g protein. It's a cellular protein, which means it's in the cytoplasm. RAS binds GDP in its resting state, okay, and then bind GTP in the active state. The active RAS normally, or the normal form, autocatalyzes hydrolysis of GTP back to GDP. So when the RAS is normal, it binds GTP in its active state, catalyzes the GTP to GDP, and goes to the resting state. The abnormal RAS fails to hydrolyze GTP, okay? And as you now understand, if it fails to hydrolyze GTP, the abnormal RAS will remain permanently active. It's going to be active all the time, okay? And it's important to mention here that we have 3 human RAS proteins, H, N, and K RAS proteins. All right. We talked about the RAS protein, and at the beginning of the lecture, in our second slide, we mentioned the farnesyl transferase. So what is that? It's a zinc metalloproteinase, which means it's an enzyme that uses the metal zinc as a cofactor. It catalyzes the attachment of a farnesyl group to the RAS protein. Okay, why? Because as I mentioned, RAS is a cellular protein. Okay, so the farnesyl transferase will attach farnesyl group to the RAS that act as an anchor, okay, or a hook to attach the RAS protein to the cell membrane. The hydrophobic farnesyl group anchors RAS to the inner part of the cell membrane, as we said that. Farnesylation is necessary for RAS to become activated during signal transduction. Why? Because if RAS stays moving in the cytoplasm, it's going to be swimming in the cytoplasm, it's not going to do anything. But you need the RAS to be attached to the inner part of the cell membrane to be part of the signal transduction pathway. Inhibition of farnesyl transferase, in theory, should inhibit this process, inhibit the enzyme, inhibit the process that will lead to inhibition of the RAS anchoring to the cell membrane, and that will keep RAS floating around in the cytoplasm. Okay, so what's the enzyme mechanism? How farnesyl transferase do its job? Well, as we said, it attached a farnesyl group. This is the farnesyl group to the RAS protein. Okay, and this figure only shows the terminal tetrapeptide of the RAS protein. Like this, the end The remaining of the RAS protein is not shown in the figure. Okay. The terminal tetrapeptide has a cysteine, so the thiol group will interact with the farnesyl diphosphate that leads to kicking out the pyrophosphate group and attaching this farnesyl group to the enzyme. All right. Then further metabolism will happen by the RCE1 enzyme that will cut the tetrapeptide group here and form a terminal carboxylic acid. Okay. The problem is that this terminal carboxylic acid is polar. Okay, and because it is polar, it is going to hinder the attachment of the farnesylated RAS to the inner side of the cell membrane. So what's going to happen? Another enzyme will come in, which is the ICMT1. This one. It will attach methyl group to the terminal carboxylic acid to form methyl ester. Then phosphatase enzyme will attach the RAS protein to the cell membrane. All right, this is how mechanism is done. Okay, the farnesyl pyrophosphate or farnesyl diphosphate binds to the active site first. Okay? As you saw, the farnesyl transferase attach the farnesyl diphosphate to the RAS protein. So the farnesyl diphosphate binds to the active site first, and it aids in binding of RAS protein to the active site. So you cannot first attach the RAS protein to the active site, then bring the pyrophosphate. You have to bring the pyrophosphate first, then bind the remaining of the RAS protein. Magnesium ion and iron ion are present as cofactors. So we know that the RAS, the farnesyl transferase is a zinc metalloproteinase, so it uses zinc, and now we know it also uses magnesium and iron. Magnesium ion interacts with the pyrophosphate group, which results in a better leaving. Okay? While iron interacts with thiol group of cysteine, and that resulted in thiol acting as a better nucleophile. All right. As we said, as you saw in the figure, it only shows you the terminal tetrapeptide. So why is that important? Because substrates, RAS proteins, share a terminal tetrapeptide moiety called the CAAX peptide. Okay, this substrate, where C stands for cysteine, A is either valine, isoleucine, or leucine, while X is methionine, glutamine, or serine. That is the substrate for the farnesyl transferase. Why this is important? Because they took that substrate and they started variation of that substrate. The aim is to have good inhibitory activity versus the enzyme, the ability to cross the cell membrane. Why? Because the RAS protein is in the cytoplasm and the farnesyl transferase is also in the cytoplasm. So you need the inhibitor to cross the cell membrane to reach the enzyme. And because we know our inhibitor is going to be traveling through the body, so it needs metabolic stability. And as you know, the human body is what? It is filled with water, so we need aqueous solubility for the inhibitor and oral absorption. So our inhibitors should balance between hydrophilic, hydrophobic properties, and that means favorable pharmacokinetic property, which is not easy. Okay, so they, as we said earlier, they took the substrate, this substrate and start variation of that. They start changing the amino acid. They kept the cysteine because you cannot change it. You need it for the attachment, and they start changing the other amino acid until they came up with this inhibitor, where C is cysteine, as we said earlier, A, valine, isoleucine, or leucine. The X is methionine, glutamine, or serine, except that the inhibitor has phenylalanine here instead of the valine or isoleucine or leucine. All right. The inhibitors were developed to mimic the terminal tetrapeptide. Why? Because this terminal tetrapeptide shared among the different fast proteins. The tetrapeptide having phenylalanine next to the methionine, glutamine, or the serine act as inhibitors. But this serves as a lead compound. Okay, you cannot use it. Why? Because it's still a peptide. And when you introduce a peptide inside the body, it will be degraded by the action of the enzyme. So the lead compound is this one. You can see here the cysteine, the valine, the phenylalanine, and the methionine, or the methionine. It's up to you, whatever you want to call it. It doesn't matter. You see them here. The disadvantage, the terminal carboxylic acid is the first disadvantage, likely to be ionized, which is bad for absorption. We said we need it to be hydrophobic enough to be absorbed. Also, the peptide bonds are susceptible to enzyme catalysis. This bond, peptide bond, and this bond, peptide. Poor stability to digestive or metabolic enzymes. Example, the aminopeptidases, because it's a peptide. So, what can we do? We can take the lead compound and try to design drugs based on that lead compound. This is our lead compound that is a tetrapeptide, which is a peptide. It has cysteine, valine, phenylalanine, and methionine. What they did, they developed a peptidomimetic inhibitor. And as the name implies, it looks like a peptide, but it is not a peptide. Okay? They used groups to mimic the peptide. Modifications carried out to remove the peptide nature. Okay? The ester mask the polar carboxylic acid. We said this is the first disadvantage, so they use ester to mask that carboxylate ion. That means this acts as a prodrug. The methylene amino link replaces the N-terminal peptide. This peptide bond was replaced by the methylene amino. The methylene amino link introduces resistance to aminopeptidases because it is not a peptide anymore. Okay? Peptide bond isoster introduced to mimic the central peptide. This one, the central peptide bond, was removed and they used peptide bond isoster. The isoster should be capable of mimicking any binding interaction that the peptide bond has. Okay, the isoster also should be stable to enzyme catalyzed hydrolysis. Replacing the peptide bond with the methylene amino groups introduced a different problem. Well, now it is resistant to hydrolysis, but now we have different problems. The resulting amines are more nucleophilic than the original peptide. Well, why? Because the lone pair of electrons in the peptide are shared with the carbonyl group. Okay? But now it's just an amine. So the lone pair of electrons will be free. One of these, which is the central one, was able to carry out an intramolecular cyclization with the terminal ester to form an inactive diketopiperazine structure, as you can see from the figure. Okay, as we said, the lone pair of electrons on the nitrogen will attack the terminal ester. This arrow means that the bond with the oxygen will be open up, then closed again, and that will kick the ester out. This will form the diketopiperazine structure. Unfortunately, this structure is inactive, so we are going to lose the activity. Okay, what can we do about that? What are the solutions? Let's see some examples for farnesyl transferase inhibitors, and let's see what scientists did to overcome this problem. Okay. First, the FTI 276, where the R group is hydrogen, while the FTI 277, where the I group is isopropyl, which means they mask the terminal carboxyl group. They kept the thiol group because it's important for activity, and the terminal amino group, but it's important for the binding to the enzyme, and they put an aromatic substituent to resemble the inhibitory activity of the phenylalanine. They used stable methylene amino group instead of the terminal peptide bond, and they used a phenyl group as a peptide bond isostate. Okay. The thiol group forms important interaction with the zinc ion cofactor. That's why they kept it, they didn't change it. The methylene amino link is stable to aminopeptidases, and the aromatic substituent is important for inhibitory activity. Now, this is the first aromatic substituent. The aromatic ring acts as a peptide bond isostate, okay, as you can see it in the figure. The terminal amino group is ionized and bond or interact with the phosphate group of the farnesyl pyrophosphate. So the terminal amino group, when it is ionized, when it becomes positively charged, it's going to act or it's going to have the job of the magnesium ion, and that will binding or interacting with the pyrophosphate group. Okay, the terminal carboxylate group is important for binding, so that's why they just mask it with the isopropyl. Another example of the farnesyl transferase inhibitors, the L739750 and the L744832. The only difference, as you can see, is the R group here, either hydrogen or isopropyl. In this one, they kept the terminal amino group, the thiol group, and the aromatic substituent, but they changed the other thiol group with sulfone. They also used the same methylene amino group to change the terminal peptide, but they used a peptide bond isostate that is different from the first example. The thiol group forms important interactions with zinc ion cofactor, as we said. The methylene amino link is stable to aminopeptidases, and now you know that. The aromatic substituent is important for inhibitory activity because it resembles the phenylalanine, and the methylene oxy group acts as the peptide bond isostate. This is the methylene oxy, which is really just an ether. The terminal amino group is ionized, and it will form a bond with the phosphate group of the farnesyl diphosphate. And the terminal carboxylate group is important, so we just mask it with an ester. The sulfone here increases the activity, and they noticed that by testing these compounds against the enzyme. Okay. Another example, which is the AZD or AZD 3409 or 3409. This one has a pyrrolidine ring, and they kept the aromatic substituent. They mask the thiol group, and they also mask the terminal carboxylate group, which this one has, you can call it a double prodrug. Okay, they go back and they use the peptide bond isoster, which is the phenyl ring. Okay, as we said, this acts as a prodrug, or actually it's a double prodrug. The thiol and carboxylic acid group are both masked in the prodrug. This will lower the toxicity risk of the thiol group. As you know, thiols are reactive. Okay? And it's not only lower the toxicity, but it protects the thiol from possible metabolism. The pyrrolidine ring here introduces conformational rigidity. So the molecule will not be freely rotatable. Okay? It's not like a single bond. Now it is locked in a ring. This results in a potent inhibitor. The Ki for this inhibitor is just less than 1 nanomolar. And I think you know what Ki means. Also, this inhibitor inhibits geranyl transfer, or GGTase, which catalyzes prenylation with geranyl diphosphate. And we will talk about that later. Agents inhibit both enzymes are potentially advantageous, or as they thought. Okay, all the examples earlier are peptidomimetics. It looks like peptide, but it's not peptide. Well, now this structure 1, which has an IC50 of 1.4 nanomolar, okay, it's not a peptide. Okay, it has an imidazole ring. It's a non-peptide inhibitor. The imidazole ring acts as a zinc ligand, and that's why you don't need the terminal thiol group, because you have the imidazole to replace the terminal thiol group. It decreases the risk of toxicity due to a free thiol group. Another example of a non-peptide inhibitor is the lonafarnib, which has an IC50 of 1.9 nanomolar. As I said, it's a non-peptide inhibitor. Okay, it's developed from lead compound discovered by screening compound libraries. I think approximately 2,000 compounds. Lonafarnib is 10,000 times more active than the lead compound. So if this one is 10,000 times more active than the lead compound, and the IC50 for lonafarnib is 1.9 nanomolar. So what is the IC50 for the lead compound? I will leave you that. No ligand for the zinc cofactor is present. And when they saw that there's no ligand for zinc binding cofactor, so they said, well, what is going to happen if we add a zinc binding ligand or ligand, whatever you want to call it? This results in the development of an inhibitor that's called SCH226374 that has an IC50 of 0.36 nanomolar, which means it is more active than lonafarnib. It has a steric shield and an imidazole ring. The imidazole ring, as you know, acts as a zinc binding ligand. It's still a non-peptide inhibitor developed from lonafarnib by structure-based drug design. The imidazole ring introduced as zinc ligand or ligand. The aromatic ring, the one that you can see it in the structure, introduced as a steric shield to prevent metabolism. All right. Now let's take example, which is the tipifarnib, and let's see the development of that tipifarnib. First, they started from a lead compound. This compound number 1. The IC50 for this compound is 180 nanomolar. All right. This one has an imidazole ring and a quinolone. Okay. The lead compound was identified from screening compound libraries. The imidazole ring present, which is a zinc ligand. Both aromatic rings of the quinolone are important activity. Okay. So what they did, they added fluorine atom. And what development strategy is that? It's variation of substitute. Okay. We have hydrogen here. Here we have fluorine. The activity increases with the introduction of metachloro substitute. As you can see, the IC50 for compound 2 is just 35 nanomolar. All right. Compound 3 was developed from compound 2 using variation of substituent strategy. Also, the activity increased with the N-methyl substituent. Okay. The IC50 for compound 3 is just 15 nanomolar. Now, compound 4 was developed from compound 3. Here, the strategy is somehow a little bit different. They use variation of ring substitute. Okay, so you see all the compounds. Compound 1, 2, and 3 has just hydrogen. They use now methyl. Also, the activity increases. Now, tipifarnib, which is the final product, now we call this an extension strategy. Extension strategy, which means that we added some groups. Okay, not we, I mean other scientists. They added groups to the molecule. That's why we call it extension strategy. This added extra functional group. This one. This results in extra binding interaction and increased activity. So we go from 180 nanomolar to 0.6 nanomolar, the IC54 tipifarnib. All right. But there are other factors in the action of farnesyltransferase inhibitors. Those inhibitors shows potential as anti-cancer agents, as you saw from the inhibitory activities. The anti-cancer activity may not necessarily be due solely to farnesyltransferase inhibition. Why? Because farnesyltransferase inhibitors inhibit farnesylation of the HN and KRAS protein. Okay, but the NRAS and the KRAS can be preannihilated by GGT. And as I said, we are going to come back to the geranyl transferase. The GGTase provides alternative mechanism of attaching RAS to cell protein. And that's the reason we said an inhibitor able to inhibit both the FT and the GGT has potential as anti-cancer agent. The FTIs still have anti-cancer activity in cells, expressing the excess KRAS. And that is why we said the anti-cancer activity may not necessarily be due solely to farnesyltransferase. Inhibition of farnesyltransferase may affect other cellular processes other than RAS farnesylation. Okay, inhibitors acting on farnesyltransferase and GGTase are too toxic. That is the problem, because they inhibit two important enzymes, and that will lead to toxicity. Okay, what is the future focus? The farnesyl transferase failed to reach the clinic, which means there is no FDA approved farnesyl transferase. Okay, and attention has switched to other targets involved in the RAS processing. If you remember the figure that we showed at the beginning of this lecture, the RCE1, the ICMT1, and the phosphatase enzymes, or in the biosynthesis of the farnesyl diphosphate. And thank you for listening, and we will keep going with the other lectures. Bye-bye.